Singapore's Health Ministry aims to train 10,000 nurses in general palliative care by 2030. That's over a fifth of the country's nursing workforce. The ministry says this will equip nurses with skills to not only manage the physical needs of a patient at the end of their life, but also their emotional and spiritual well-being.
We should also go beyond nurses to equip family physicians, allied health practitioners, and community care workers with the same skills. In doing so, we can better support patients seamlessly through every stage of their journey.
Mr. Ong was speaking at the Singapore Palliative Care Conference, where he also shared updates on the refreshed national strategy for palliative care launched in 2023. Between 2023 and 2025, more Singaporeans have received care in their last year of life. Home-based and inpatient hospice capacities have also increased by at least 30%. But Mr. Ong says more can be done to help Singaporeans pass on peacefully and comfortably at home.
While more patients are receiving palliative care, many of them do so in acute hospitals. If they are not discharged to receive palliative care in community settings such as at home or in hospices, it is natural that they will pass on in hospitals. And for many of them, actually that's not their preference.
The ministry believes the key constraint to home palliative care lies in the readiness or confidence of families and caregivers to carry out certain care tasks, especially complex or unexpected procedures. But as CNA's Nadine Yeam finds out, more plans are in the works to support patients and their caregivers.
Dealing with end-of-life care is never easy. But for Dr. Angel Lee, palliative care in Singapore is something she's been working on improving for over 3 decades.
A lot of people think that palliative care is about giving up. But actually, palliative care is really about shifting the goals of care, shifting from curing an illness to the care of a person. And in fact, we fight very hard to ensure that a person is comfortable and that their quality of life is as best as the illness can afford it, and ensure that they get the dignity that they deserve at the end of life.
And for her contributions to the sector, Dr. Lee was presented the Lifetime Achievement Award at the Singapore Palliative Care Conference. And the Health Ministry wants more people like her. Health Minister Ong Ye Kung announced a target to train 10,000 nurses in general palliative care competencies by 2030. He also emphasized the need to provide more support for caregivers.
That way, patients and families have greater confidence to undergo palliative care at home. That is the flexibility and the ubiquitous skills that we want to achieve. Family members and caregivers are learning constantly, boosting their confidence. And should there be an emergency, someone, whether the GP or community nurse, can turn up at short notice to provide the necessary support.
The Health Ministry also plans to continue making palliative care affordable to those who need it. Besides existing subsidies and raise MediShield life claim limits for inpatient care, plans are underway to improve the awareness of the reduced life expectancy scheme for eligible patients, streamlining the referral and approval processes so as to help patients avoid multiple clinical assessments where feasible.
And this is a balance that needs to be struck for every patient. Beyond funding, support systems, and trained healthcare workers, the most important work that needs to be done for palliative care is in its humanistic acceptance.
And that means caring for a person does not necessarily always mean treating their disease, and that the value and dignity of a human being transcends their physical health.